I have seen so many kids coming into the department after eating gummy bears or edibles that they thought looked like candy, but actually had cannabis in them.
Store your cannabis products in a safe place to ensure that minors don't have access to them, just like you'd store your alcohol or your prescription medication.
Cannabis-related trips to the hospital for adolescents and young adults in Ontario increased nearly fivefold in the years leading up to legalization between 2003 and 2017. That's according to a new study led by the CHIO Research Institute. The study examined more than 14.5 million administrative records of visits to emergency departments in the province during that time and found not only did the rate of cannabis-related youth visits increase, but also the severity.
Meaning that a higher proportion of young people were admitted to hospital and had higher acuity scores assigned by triage nurses.
What does that look like symptomatically? What does an ER visit due to cannabis look like?
The most common effect that we see in younger children is that they're a little bit lethargic, meaning very sleepy, not quite themselves. Some confusion is common as well too. In older kids and teenagers, we actually typically see more often the opposite, agitation.
Dr. Bichard says nausea and vomiting are also common, and in rare but severe cases, heart arrhythmia, seizures, or levels of consciousness so low a breathing tube is required. She says while the study didn't look to assign causes, there are a few possible factors.
The THC content of cannabis products has been increasing. There's new ways that people use cannabis, like vaping, which can deliver a higher dose more quickly and maybe cause more effects. And it could also be, too, that before legalization, attitudes about cannabis were changing. So maybe physicians were more likely to ask patients about it, or maybe patients were more willing to disclose that they'd used cannabis.
Legally licensed cannabis stores will actually help to alleviate the problem of minors and children getting into these products.
Meanwhile, the president of the Retail Cannabis Council of Ontario says any product bought through a licensed retailer comes in packaging that's both unappealing to kids and hard for them to open.
The packaging of those products come in child-resistant packages. And Health Canada goes out of its way to ensure that those packages do not appear or appeal to minors.
Also, he tells us there are rules concerning what kind of dosage a licensed retailer is allowed to carry.
The edibles especially are only allowed to have 10 milligrams of THC per package. Edibles from the illicit market aren't restricted because they're not governed, and they can contain anything. I've seen packages that contain up to 1,500.
Dr. Bichard saying the issue still isn't on the radar for a lot of people. She's urging parents to have conversations with their kids.
It's really important to still emphasize to kids that it can be dangerous, because many people that I speak to are surprised that you can end up in the emergency department after using cannabis.
For City News, I'm David Zura.